maintaining your sexual and urinary function and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, we're back. It's Dr. Lederman. We're talking about cancer treatment. We're happy to take your calls. We're happy to see you in our office, which is only a few steps away on 38th and Broadway. We have Dr. Eisen on the line. Dr. Eisen is a radiation oncologist, born in Argentina, fluent Spanish speaker, who I think wants to talk to you about skin cancers and radiosurgery. So good morning, buenos dias, Doctor.
Buenos dias. How are you?
So you're going to talk to us today about your Spanish-speaking patient, and he's had multiple surgeries. He's had twice surgery, and now he has a recurrence of basal cell or squamous cell in his nose?
Basal cell.
So there's a basal cell in his nose, and it's very extensive. His nose, I saw him with you. You introduced him to me, and he has very extensive disease. He's had surgery twice, and it didn't work.
And that's one of the problems, because sometimes it's not just only for the cosmesis, but people are thinking that...
Well, cosmesis is important. I mean, that's why people come to us. They want to be cured, and they want to have their nose. Right. I mean, if he went to have surgery or Mohs chemosurgery, he'd probably lose most of his nose. They'd start cutting, which is what Mohs does. And he has a very particular surface to the nose. We all do, in fact. And when they start cutting off the nose is the first thing people see when they meet another person.
Now, doctor, your treatment of radiosurgery, that would not affect the appearance?
Probably his nose would look better, because you'd probably end up getting rid of a lot of the irregular skin and cancer.
Okay, wow.
I agree 100%. And the second thing is that sometimes people are thinking that skin cancer is something that it's easy to take care and just...
Well, it's easy with us if they come to Radiosurgery New York, because we're so effective at it.
Because skin cancer actually can keep coming back and back, and then...
Well, because people that have skin cancers usually have had sun exposure, and usually there's other areas.
So he was very, very happy, because we are going to develop a program exactly like custom-made.
Well, we have a program. We have a program called Radiosurgery, and it allows us to hit the cancer, not hurt healthy tissues. Our success rate is very high. We treat a lot of cancers of the skin of the face, the ear. I had a man this week. He actually heard us on the radio last week. So a businessman, very professional businessman, came with a mass on his ear. You had this man with, I think he had 2 basal cells on his nose, correct?
Right, 2, and it keeps coming, and that's
actually
why.
He had another cancer on his neck. So these people are at risk, and we encourage them to come in, because you can give them a great result.
So they were extremely
most likely
happy also, because they had a chance to discuss everything in Spanish. That was very important, particularly because the family members also, they were able to interact everything in Spanish. They were very happy because we were able to go over every single report. So it was a great moment, not just only to let them know exactly what we do, but also be able to go in detail with the whole consultation in their own language. And
well, it's very important. It's very important for listeners to know, if you've got a suspicious lesion in your skin, please come in and see us or see your dermatologist. Before you get cut, you might want to seek other options, including non-invasive, non-cutting options. So it's a teaching point, especially around the ears, eyes, nose, and mouth. Those are areas where surgery is very hard to recreate what God has given us.
So I just want to leave my telephone number for, so my number is 917-836-8105. For the Spanish-speaking community, Para la comunidad en español, mi número es 917-836-8105. One more time, 917-836-8105.
All right. Gracias. Thank you. And lots of people say how great you are. So thank you very much.
Take care.
Bye-bye. See you soon. We had another caller this week, a man with a Gleason 9 cancer. Gleason 9 is how aggressive the cancer is. There's a scale of 2 to 10. The lower the number, the less aggressive. The higher the number, the more aggressive. This man had a Gleason 9. His doctor said, you have a Gleason 9, and I booked you for surgery on Tuesday.
Wow.
For robotic surgery. So what's the data?
Surgery.
Puppet surgery. So what's the data? What's the likelihood? Well, this man fell out of his chair when he heard the fact that with surgery, robotic surgery, or open surgery, in the best hands in America, the likelihood of being cancer-free is only 23% in the best hands. I'm not talking about average hands.
Wow.
23%, meaning 80% of men have recurrence of their cancer with robotic surgery.
I can't say I want those stats on my side.
Our data for Gleason 9, it's in our booklet, along with that data I just told you. Our data is on page 15. This is our data for 3,000 men. If you've got a Gleason 8, 9, 10, our data shows a 70% chance of being cancer-free, and that's even without hormones. If you add hormones, it's higher. But we're talking about 20% versus 70%. So you can obviously, where would you choose? The place with 20% success? Or
without a doubt, 70%.
Right. And furthermore, there's an article showing that the success in keeping sex life with robotic surgery or open surgery is very low. What percent of men have normal sexual function, no problem after surgery with robotic? Do you remember that number?
I don't, but it was somewhat, it was very low.
2%.
Yeah, I was going to say 5, but yeah.
Okay, 2% have no problem after robotic surgery. That means 98% of people do. And there's also other issues with robotic surgery, which we'll report on another week, and that is the complication rate, perforation rate, and the fact that the government is coming after robotic surgery because they are not reporting their complications. One other thing I wanted to talk about in the prostate cancer department was where you get treated, even with the same so-called treatment. Let's say you get brachytherapy and radiation. Brachytherapy means we put radiation seeds through the skin. They allow us to give higher doses of radiation to the prostate. In our facility on 38th and Broadway, we have our own operating room, own anesthesia, our own recovery room. So you just walk in, get the treatment. It takes about 45 minutes. Wake up, put on your pants, and get out of here.
Out the door.
Which is a lot better than being elsewhere, including in a hospital. Now, if you had... I just want to go to this data, and I'll find you the page. Page 17 of our prostate booklet, and we'll mail this booklet and DVD to you at no charge if you call us with your name, address. No problem about that. If you have intermediate risk, let's say you have a low PSA, but a Gleason higher than 6, meaning Gleason 7, 8, 9, 10. If you go elsewhere to a famous hospital in New York, their success rate is 72% cancer-free survival.
Okay.
Ours, if the same patient with the same numbers comes to us, it's 92%.
Wow.
So not all treatment is the same from place A to place B to place C, and we urge people to look at the data before you choose. Certainly look at the data before you get sucked into robotic surgery. It does not seem to be the miracle cure that people are alleging. And we even have a letter here from a doctor who's director of robotic surgery at a big cancer hospital nearby. And he wrote this about a patient. He said, Mr. X was most interested in learning about surgery for prostate cancer, in particular robotic procedure. I explained to him the details of the operation and anticipated post-operative course. I reviewed the short and long-term. This is the surgeon's words to the patient. I reviewed the short and long-term risks of surgery. What did the head of surgery, robotic surgery, say about prostate surgery at his big cancer hospital? Side effects include, but are not limited to, infection, bleeding, deep venous thrombosis, pulmonary emboli, bowel injury, rectal injury, ureter injury, cardiac or respiratory problems, penile shortening, urethral strictures, incontinence, infertility, and impotence. Lastly, quote, this is a surgeon explaining. He's the head of robotics. Lastly, I explained that while I prefer robotic approach, there is no convincing study demonstrating clear superiority over either open or conventional laparoscopic prostatectomy. So why are they doing it?
Yeah,
It costs millions of dollars to buy the machine. There's all these complications. Why the heck are they doing it? And we have data to show their results are inferior. So why are they doing it? I call it betrayal, and it's on my list of betrayal because I think it's really betrayal when they're leading people on that they say there's 98% success rate, that everyone's sexually functional, everything's great, and then you look at the data and you have the words of the surgeon himself.
Directly from the
why would you get all these complications?
Yeah, it didn't
described?
sound so. Not a list I want to.
And why would the head of robotic surgery say that there's no benefit? Why would he say that?
Maybe because he asked to, Doc, and that's...
Well, he maybe asked to on paper, but does he say the same to the patient, to their face?
Right, who knows?
I call it betrayal, and we have a list of sad betrayals. Also, we had a little girl come in this week who had tomotherapy. People often ask us, well, what's the difference between tomotherapy, cyberknife, and what you do, Dr. Lederman? We were the first to do body radiosurgery in the Western Hemisphere. Well, this little girl had 28 treatments on tomotherapy. Tomotherapy does a CAT scan on the patient every day. And sometimes they do 2 CAT scans. Of course, they charge for it. So you can imagine this little girl had somewhere between 28 and 56 CAT scans to line her up when there's technology that doesn't require CAT scans. It doesn't give you radiation. If I came and told a patient, wow, you're going to be getting somewhere between 28 and 56 CAT scans over the next month for treatment, they would go nuts.
Sure.
And I think that often people are not told what exactly they're going to get into. So we're getting near the end of the hour. We still have a long list here. We're going to continue on. We have 2 shows on WOR, one tomorrow at 6 to 7 a.m. We're going to continue on this list. And also we have a stack of new cancer news to try to make your life better and more sane and not spend money on things that may well harm you or certainly may not help you. We have Dr. Paul Offit, the author of Do You Believe in Magic, tomorrow night on WOR from 9 p.m. to 10 p.m., and we'll be taking your calls. So if you have questions during the week, call me directly at 212-CHOICES, 212-CHOICES. That's 212-246-4237. This is Dr. Lederman. I'm running to pick up my son who's flying in from L.A.
Yes.
Have a great week. Thank you, John.
Thank you,
and
Dr.
all
Lederman.
of your listeners, God bless you. Have a great week, and looking forward to meet you in person.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Joan Bennett. After deliberating late into the night, a jury in